Hospitals in the United States are preparing for a possibly overwhelming number of coronavirus patients in the coming weeks as the cases continue to rise. But doctors, nurses, and healthcare workers are confronting a dire shortage of basic things like masks, surgical gowns, and eye gear to protect them from the virus. Yesterday, President Trump said there was no immediate plan to address medical equipment shortages by activating the Defense Production Act. Today, the president said this.
Mr. Vice President? Because you just said that you haven't had to require companies to up their production of medical supplies. But you said last night you invoked the DPA.
No.
I'm confused.
When we need something, because of the act, when we need something, we order something.
Joining us now is Dr. Rob Davidson. He's an emergency medicine physician in Michigan. He's the executive director of the Committee to Protect Medicare. Dr. Davidson, thank you for being with us. What is it? Which one is it? Is the government invoking its ability to get the manufacture of these things, or are they not? Because it does. The messages are entirely clear from everyone in the medical and public health community with whom I've spoken to in the last few days. There are about to be critical shortages.
Yeah, and we're in full preparation mode for what is to come over the next several weeks. And in our hospital and hospitals across our system in West Michigan, we're conserving masks. We're using the same mask for an entire shift and storing it in a paper bag and sterilizing our hands as we put the mask on and take the mask off as we go into every room. We understand that with the influx of patients that we are anticipating, these supplies will run out at some point. So I don't know what they're doing behind the scenes, but certainly the mixed messages from the president, or if he is declaring that no one has told him that it's a problem, or doctors aren't saying that to him. If he's watching right now, there's a doctor here, and I'm representing many doctors across this country. We need their help. We need leadership in this respect.
Dr. Davidson, let's just play this out for a second. Let's say I'm not believing any of this hype, right? Somehow I'm consuming the information the president's putting out there that anybody who needs a test can get tested. There's no shortages. We don't need to invoke these kinds of things. And all of a sudden, I'm a man of a certain age, I get a heart attack, or something else happens, or my appendix needs treatment, and I call 911, and I go to a hospital, and I find out that there are beds that are problematic, or you've been using the same mask all day, or the Red Cross says they might be 2 weeks away from running out of blood. This is not just about coronavirus. This is about our entire medical system.
Absolutely. I mean, our committee of doctors, the Committee to Protect Medicare, is advocating for affordable health care, before this started, after we eventually see our way through this. But this is what I tell people who try to say, well, I won't be affected, or I have such a low likelihood of being affected myself. We see young, healthy people on ventilators, already with this crisis. But if our hospitals are overwhelmed with patients with coronavirus, what happens? That's what I'm concerned about. I've been serving in my community for over 20 years, or for nearly 20 years. And, I've kind of taken a pledge to serve those folks. And, we have to make tough decisions from time to time. I don't want those decisions to be tough because my government has let me down and not gotten us the equipment we needed. If he thinks that anyone who wants a test can get a test, I can tell you I've worked the last 3 nights. And just a few nights ago on one particular shift, I saw a handful of patients. Each one of them should have had a test if they were available. But we are rationing tests because they just aren't there. We're saving them for the sickest patients.
So Dr.
And
Davidson,
we're sending people home and telling them,
I don't mean to interrupt you, but let's just be clear about this. In fact, I'm going to ask my control room to just play a shortened version of an answer, a conversation between our PBS colleague, Yamiche Alcindor, and the president about the availability to testing. Let's listen to this.
There are Americans, though, who say that they have symptoms and they can't get tested.
Well, okay.
What do you say to the Americans who are
I'm not hearing it.
I'm not hearing it. Dr. Davidson, is that a possibility? I mean, I'm not in the business of accusing the president of lying if I don't know otherwise. I don't imagine how any American has heard that there aren't shortages of tests for people who may need them.
Right. If he's not hearing it, he's not listening, because we've been crying out as a chorus of doctors and nurses and and folks in healthcare across this country. I will tell you, there is a shortage. We are rationing. In the United States of America, we are rationing these tests. Our first case in this country was the same day as the first case in South Korea, and they were testing 10,000 a day from a week after that. And we're still struggling in my state, and I know in states across this country, but in my hospital, again, a handful of people, 5 people I saw on a night shift, and not one of them could get a test because, you know, frankly, we just are told we don't have the ability to do that. This is coming down from the state. You know, they have limited supplies. I understand why the state is doing this, but for the president to suggest that, you know, again, I guess I wouldn't be in the business of calling him a liar, but he's obviously not listening to the people on the front lines.